Hello, I'm Joyce Fitzpatrick, and I'm here to talk about storytelling and the value of storytelling to nurses and patients. So, first of all, why should nurses tell stories about their work? It helps them to gain value for what they do at the bedside with patients and families. And secondly, it helps other nurses to understand the value of the care of their colleagues. So it's a means to empower them to really value the nurse-patient relationship and to share that experience with other nurses. So there are questions about how to get started telling a story about a nurse-patient relationship. The first thing is to think about a meaningful encounter that you had with a patient that had a memory for you, but also an encounter that you know made a difference in the patient's care and in the family's understanding of the patient's care. So if you think about that encounter, and you think about what steps that you took and you begin to tell that story to your peers. It's very important. There are several components that make a good story. First of all, you want to set the scene. You want to tell people what was happening at the time, were there other people around? Was it day or night? Was it a busy time for you? Was the patient very ill? Or was it a patient that needed some emotional support? So setting the scene is the first step in telling a good story. Secondly, it's important to build tension. Why was this encounter important to the patient? Why was the relationship important to you? So that's the next step in telling a good story. The third thing that as nurses, we know that we make a difference, but we want to share our knowledge and our skills with other nurses. So in concluding your story, you want to communicate to the other nurses why this particular encounter was meaningful to you and to the patient and family. So in summary, it's important for all of us to share our experiences. We can learn from each other. We can learn from our patients that we care for. And by telling our stories, we acclaim our work as nurses and give power to the work we do to save lives and to help patients and families. Thank you.